Hello and welcome to Arabic Hour. I am Hubert Murray, an architect in Boston, and I've been involved in the development of a kindergarten in Ida Camp in Bethlehem, the West Bank. With me today are two doctors, Bram Wispelwey and Dr. Alice Rothschild, and we're here to talk about healthcare in Gaza and in the West Bank. Dr. Bram Wispelwey is an associate physician in the Division of Global Health and Equity at Brigham and Women's Hospital in Boston and senior technical lead at Partners in Health, United States. Bram is also co-founder and chief strategist of Health for Palestine, a community organizing initiative in Palestinian refugee camps that seeks to maximize wellness and address health barriers via social accompaniment and creative integration with existing facilities. Bram has published extensively in medical journals and recently with Michelle Morse in the Boston Review on an anti-racist agenda for medicine. Dr. Alice Rothschild is a physician, author, activist, and filmmaker, a retired obstetrician gynecologist affiliated with Beth Israel Deaconess Medical Center and Harvard Medical School. She worked in the healthcare reform and women's movements for many years and is now writing and speaking and blogs when inspired or particularly outraged by the state of the world. Since 1997, she has focused much of her energy on understanding the Israeli-Palestinian conflict. For an extensive list of Alice's books and articles, you can refer to her website, alicerothschild.com. But we're here to talk about healthcare in Palestine. As we speak, it is day 45 in this iteration of the hostilities, with the continuing massive bombardment of Gaza by the Israeli Defense Forces in response to the assault by Hamas and others on the Israeli communities on Gaza's northern border. Following the massacre, Israel has conducted a continuing and continuous campaign of aerial bombardment. At last count, a few days ago, Israel had destroyed or forcibly closed 18 out of 36 hospitals and 46 out of 72 clinics. Almost 50% of the entire housing stock of Gaza is destroyed or uninhabitable. Having instructed the population to evacuate and move south to Khan Yunis to avoid the destruction, Israel has now taken to bombing the southern half of the territory, whose population is caught with nowhere to go. Some with foreign passports have been allowed out, but the vast majority are trapped. Alice, you have extensive experience in Gaza. Could you give us a quick summary of the situation, concentrating in particular on the medical aspects of this humanitarian crisis? The scale of the disaster is so vast, it is perhaps hard for an American to come to terms with the enormity of the death and destruction, and indeed the continuing trauma of those who are still nominally alive. Help us come to some understanding of the scale of the catastrophe and what it means for a Palestinian family.
So I think you're right in saying the level of catastrophe is sort of beyond our wildest imaginations. To understand the realities, I think it's important just very briefly to talk about what the healthcare system was like before the attack. Gaza has been under since 1967 under a occupation, and then the last 16 years has been under a severe blockade, which means that the Israeli government has prevented essential medical equipment, medicine, and all the sort of infrastructure of healthcare to be able to get into the Strip. In addition to which, even though they have two medical schools, it's very hard for people to get high-level training outside of the Strip. So what we see is a healthcare system that was already on its knees prior to the attack. And we also see that the infrastructure of Gaza in terms of wastewater, water treatment, sewage systems, and then housing, and all the building blocks of a healthy society were crippled by the fact of the blockade. And so that was like where people started, extreme poverty, 50% unemployment rate, a highly educated population without the ability to use their education in the economy of Gaza. And then the attack started, and it has been relentless and aggressive beyond all the previous, which are 5 previous wars since Hamas took over. It is said that approximately the equivalent of 2 atomic bombs has been dropped on an area 6 miles by 26 miles. And the Israeli military has gone after the infrastructure. So as you said, housing, healthcare, ambulances, sewage treatment, water treatment, all the things that make a healthy society have been damaged or destroyed. The population in the north was urged to move south, and many people did. And this was a harrowing journey at the beginning. At first, people were in cars and trucks, and then the Israelis made it impossible, and they had to walk. But the most vulnerable stayed in the north. And so the subsequent waves of people moving south have been the most vulnerable. So we saw elderly people, people in wheelchairs, just devastating pictures of people moving south. And moving south is a dangerous journey. There are snipers, people get shot, people get arrested. There's a checkpoint, there's reports of people having to strip and being humiliated, all sorts of horrific things. So that has been sort of ongoing. The Israeli military has also made a point of attacking hospitals. And I think if we look at the number of hospitals destroyed and damaged, it's just mind-boggling. And a couple of days ago on Saturday, they took over Al-Shifa Hospital, which is the main hospital in Gaza City. It's a 700-bed hospital, employs thousands of people, takes care of approximately 500,000 people. And the Israeli forces have gone in ostensibly to find the tunnels and the evidence of Hamas operating in a hospital, which they have found a fairly meager amount of things at this point. And this has been beyond catastrophic. So this hospital did not have electricity, did not have water, did not have fuel, which means not only is there no fuel for the ambulances, but there's no fuel to run the electricity generators. So if you can imagine a modern hospital, everything relies on electricity. So the most vulnerable people, the people in the ICU, the infants in the NICU, people on dialysis, people in surgery, all the things that require electricity, those patients were suffering, were at risk, were dying. And then on top of that, the Israeli military moved in. And they have been basically ripping up the hospital, looking for their evidence, destroying a lot of the infrastructure of the hospital. And the hospital actually had about an hour to evacuate. I think that was yesterday. And I saw reports of people being wheeled out of the hospital on gurneys, in wheelchairs, on crutches, walking south. So this is a catastrophe beyond a catastrophe. People are dying, patients are dying. The staff, which was overwhelmed prior to all of these attacks, is beyond overwhelmed. And when you say people are going south, you have to ask south to what? The southern part of Gaza is already completely overwhelmed with internally displaced people. Somewhere around 60% of the Gazan population is internally displaced, which means that families are living in UN schools. They're clustered together in small apartments with their relatives. So you'll have 50, 60 people in a small apartment. They're sleeping out on the streets. They're intense. I mean, the level of suffering is beyond imaginable. The other thing we have to think about besides the physical medical problem is the issue of mental health. The level of trauma in this population was already astronomical because of all the previous attacks and the level of general suffering. And now we have hundreds and hundreds and hundreds of thousands of people who have lost relatives, who have seen people blown up in front of them, who, when they're fleeing, are walking over dead bodies. I see reports of the smell of rotting corpses in the streets and in the hospitals. There were mass graves in Gaza City and in Rafah in the south because there was no way to deal with the dead people in the morgue, and there was no place and time to bury them. This level of trauma is unbelievable. And the other thing we need to remember is that the part of the population that is being hit the worst is the children. About 2/3 of the deaths are women and children children that suffer this level of trauma this early in their lives are going to spend the rest of their lives trying to recover from this. And my last point is that when you think about trauma and the complexity of the trauma that Gazans face, people talk about post-traumatic stress disorder as, affecting the entire population, as well as depression and anxiety. But in Gaza, there is no post-traumatic stress disorder because nothing is ever post. So you have a population suffering from chronic stress disorder, a very complex kind of disorder because of the level of trauma and death and destruction that they have witnessed.
Yeah, and of course, I mean, as you're describing this, what you're describing also pertains to people who are trying to care for those who are suffering.
Right.
The carers are suffering too.
Same level, right. And I have colleagues at the Gaza Community Mental Health Program where I have worked, and the last report I got was that the head of the program has lost complete contact with the entire staff because the entire staff has fled, is sheltering, is at risk for dying, is at risk for death. And so their whole emergency system that they had with a emergency call-in number, and patients are given the numbers of their therapists, and all the stuff that they had planned for emergencies has just fallen apart because the staff is facing the same level of trauma as the patients. And when you have no electricity, it doesn't matter if you have your therapist's phone number if you can't charge your phone. And if you're thinking about support for people in a mental health crisis, when the bombs are falling, there is no talk therapy or medical therapy or whatever therapies have worked in the past. Nothing is going to work until people are safe. The other thing I neglected to mention is that with the catastrophic destruction of the sanitation and hygiene in Gaza, there's an upswing in infectious diseases. We're seeing a lot more of respiratory, diarrheal, chickenpox, scabies. I mean, diseases that should not be rampant in a population, but are reflective of the crowding, the lack of sanitation, the lack of clean water. And also, we're now facing the issue of starvation. The food commodities are at zero in the stockpiles. People are waiting 4 to 6 hours for a piece of bread. It's unbelievable. And people are now, bathing in the Mediterranean Sea, washing their clothes in the sea, and there is untreated sewage flowing into the sea because of the destruction of the wastewater and sewage treatment plants. And people are drinking this water because they're desperate. And drinking salt water is extremely bad for your health. So the level of medical and physical catastrophe for providers and patients and the general population is just unbelievable.
Gosh. Well, as the world is sort of so focused on Gaza, as rightly it should be, meanwhile, in the West Bank, there's also lots of aggressive activity both from the IDF and from the settlers, who are basically coterminous. Bram, perhaps you describe for us what you have been doing in the West Bank in inverted commas normal times, and what you see as the situation now.
Great. Yeah. Thanks, Hubert, for that question. I think it's first important to mention that, when you look at 2023 before October 7th, you're talking about a situation in the West Bank where there have been escalation of violence, hundreds of Palestinians killed, including dozens of children. You had pogroms in towns like Hawara and elsewhere, where settlers are attacking Palestinian villages. And so you have this real escalation of violence that has now only increased since October 7th. And as you mentioned, given the scale and scope, and as Alice was just discussing, the scale and scope of what's happening in Gaza, relatively little attention has been paid in the West Bank, where the violence is also unprecedented, including, for example, an airstrike on Balata refugee camp just a couple of days ago. And so you're seeing really enormous levels of violence, and a couple hundred people killed in the last few weeks as well. beforehand, before October 7th, and thinking about this underlying context where you still have chronic violence, you still have people living in, for example, many refugee camps. There's 20 in the West Bank in poverty. We have this organization that we've been working with called Health for Palestine, which is really a community grassroots run refugee organization where you have essentially young folks being hired and trained and equipped as community health workers to act as the glue in a very fragmented healthcare system. Alice mentioned what healthcare looks like in Gaza during the best of times. You have similar challenges in the West Bank in many cases, many different providers, and very little longitudinal care or connected care over time. And so what these refugees are doing, these community health workers within the camps where they live, is acting as that glue and doing home-based care for patients, living with chronic disease, living with a lot of the trauma, right? This chronic trauma that's never post, as Alice mentioned. And so that program's been going on for about 5 years now, working in 3 refugee camps, 2 in the Bethlehem area, Aida and Alaza camps, as well as Balata refugee camp in Nablus. And from the beginning, from the earliest stages, the program's been equipped with this trauma-informed lens and curriculum because of that recognition of the chronic violence that people are experiencing under military occupation here. But because of the way that program was structured, even with this increase in violence in 2023, even with the increase in violence people are experiencing since October 7th, these community health workers have been able to continue their care uninterrupted. We've essentially, there's some reduction for the folks who are lower acuity in terms of their health needs in order to be able to respond to the more dramatic increase of needs that are present right now, but essentially been able to adjust, been able to continue providing services even in Balata camp, as mentioned, which is experiencing direct airstrikes and other incursions from the Israeli forces.
Just to give people an idea of how your Health for Palestine works, can you explain what I mentioned in the introduction about you, was this phrase social accompaniment? What does that actually mean in terms of healthcare?
One of the most important aspects of healing, right? If you think ultimately the goal, right, when people have a health problem and they're looking to improve that, to improve their health, to improve their well-being, is the social aspect of care. We think about healthcare all the time in its very technical aspects in terms of the biomedicines, but an important piece, and this has been known for a long time, has been shown in many different contexts, is the social aspect of healing, right? And so when you consider the levels of trauma in particular that are keeping people from being able to be healthy, right? What Rita Jacquemin calls social suffering, right? We often talk about in mental health terms, but is really a form of suffering that's human-made, right? It affects the body too. It's not just the mind. And I think this social accompaniment is a means of figuring out what is it that in this context now is keeping people from being able to pursue their health, right? From being able to control their diabetes, from being able to control their hypertension, and how can we work together in partnership, right? How can these community health workers, maybe it's, making sure they pick up their medications and drop them off, getting people to their appointments, right, at the UNRWA clinic or the Ministry of Health clinic. It's doing all of those little steps in a system that has been de-developed, right, in the words of Sarah Roy, that has been intentionally sort of blocked from being able to function as a health system should, and to be able to fill those gaps by the community for the community itself.
Yeah, I mean, I've seen this for myself, because when we were doing research for what this kindergarten should be like, your community health workers took me around to various people's houses. One of the most striking things that I took away from that is that young people in their early 20s, with university degrees for the most part, were taking care of their elders. The elders greatly appreciate this. The young are feeling that they are actually contributing to the community in an immediate way. It's very impressive.
Absolutely. And when you think about the conditions, right, the fundamental conditions of why are people living in these refugee camps, right, for these multiple generations, and what are they hoping for, right? And they're hoping to return ultimately. Like that is their fundamental goal as Palestinian refugees, and to being able to continue to exist, to be able to maintain themselves within these communities until they can, achieve that level of justice. They want to be able to do that, right? That kind of intergenerational work of supporting each other, what Palestinians call samud and steadfastness, is a really important part of that process, being able to maintain their communities in place.
Right. Now, we're all living in America, and you are working with Palestinian groups in Gaza and in the West Bank. Can you describe a little bit of what local teams of physicians and medical staff are able to do, and how the foreign NGOs, such as Médecins Sans Frontières and the ICRC and probably the WHO workers, how they integrate the work with local people, and how much they rely on local staff to actually do the work that they're doing?
You want me to start?
Yeah, sure.
So before the assault in October, the healthcare system consisted of the Ministry of Health, which was established after Oslo, the UN UNRWA, which is responsible for the healthcare of refugees, and then a huge number of non-governmental organizations like Palestinian Medical Relief Society that have sort of moved in to take up the space that is not being filled by the other organizations. And then there were private providers. And then all of this was de-developed a lot by Israel, as Bram mentioned. And so in Gaza, the staff were from Gaza. And so there was a tremendous use of hiring Gazans to do the actual work. What has happened since the assault is that all of this has fallen apart. The ability for anyone to do this kind of work has tanked because the institutions have been bombed, the ambulances have been bombed, the staff has been injured and shot at and fled. So to think that there's anything at this moment that individuals in Gaza can do to protect healthcare, physical and mental, is really ignoring the reality of their lives. And I'll just give you an example. There are about 5,500 women that deliver every month in Gaza. So these women, who usually get their care either from UNRWA, the Ministry of Health, or private provider, are no longer receiving prenatal care. They're no longer able to have an adequate diet. They're no longer able to drink clean water. They're living under a huge amount of stress. All of those stressors will create maternal complications for these women. And when they go into labor, they have no idea where they're going to deliver and how they're going to get there. They cannot call an ambulance. If the ambulance is there, they don't have fuel to make the ambulance drive. The ambulance can't take them to a hospital because the hospitals have been bombed. So women are in desperate situation. Their families can't support them in a system that's completely fallen apart. So some women do get to hospitals. There are reports of women having emergency cesarean sections without anesthesia because there's no anesthesia medicine, there's no morphine. When they get infected, there's no antibiotics. There are reports of women delivering in their homes with, 50 relatives in 2 rooms. There are reports of women delivering outside and in tent communities. So the whole social system and community system has really been broken by the relentless Israeli bombardment and by the invasion of on-the-ground troops and the factional fighting that's going on between Hamas and the Israeli troops.
Yeah. Bram, what do you have any experience of this?
Yeah, and I think, I think we've all seen examples of really heroic, efforts from Palestinian healthcare workers over the last few weeks in the Gaza Strip, and certainly, really over the long term in the West Bank and in Gaza as well, but thinking of just staying with their patients, supporting them, doing procedures under conditions, the rest of us maybe in the global north would faint if we were even, imagining trying to do them without anesthesia, right? Without antiseptic, without light, without electricity. So really incredible. And there has been support from international NGOs and groups that you mentioned, Hubert. But I think it's also important to mention that oftentimes, in this kind of chronic humanitarian context that's been created, right, that, while humanitarian organizations often fill these immediate needs and the breach, in the long run, they're also sort of fulfilling a space that really requires a political solution, right? And I think it's really important to mention, as important as it is and will be in the coming weeks, for these organizations to support, Gaza's, very traumatized, in many cases injured health staff. That we also think about the fact that, we can't simply subsidize the ongoing costs of the damage that's being done to the people, Palestinian people in Gaza and the West Bank, and thinking about how can we, as health professionals, as international health professionals and organizations, also help make sure we're working towards the chronic solution of a political solution and not simply filling up these urgent health concerns, as important as they are.
And looking at UNRWA, before the assault, UNRWA was reporting that due to the lack of funding, that they were not going to be able to deliver services. And now, every day I get these messages, this is the last day UNRWA will be delivering services. There's no fuel. And so they are on their last legs. And if we take a group like Doctors Without Borders, there was a report yesterday that a convoy of, I think, 137 staff and family were decided to evacuate south, and then they came under sniper fire, and they actually turned around and went back to the north, and one of them was killed. So this is not, nothing is functioning well. And I think you're right that the healthcare staff, the doctors, the nurses, all the folks are just heroic in terms of their dedication, but they're in an impossible situation.
As this is all ongoing, it's very difficult to sort of draw back and take perspective on other crises in the world that have happened with bombardment of various sorts, like, for instance, the Sudan, Central African Republic, Ethiopia. Has anybody taken the chance to look at how such societies have begun to pick themselves up and repair themselves, with similar levels of trauma, I would imagine, and with similar levels of breakdown in infrastructure? Is there anything to compare this with?
I don't know that literature. I do know a little bit about people who've evaluated trauma and this level of trauma and the repercussions that go on, particularly for children, for decades. But I'm not familiar with, comparisons between different countries that have been decimated like this. Do you know, Bram?
One of the conversations I've been having actually with some Palestinian colleagues, I'm not also deeply familiar, is to begin to explore this, though. What does health look like after experiencing violence and destruction at this level that's so all-encompassing, more than 1 million people displaced, right? All the infrastructure that would sustain life in the north of Gaza having largely been destroyed, right? What does it look like to pursue health after that when you have that level, everyone with family members who have been killed or injured, losses of livelihoods? It's so hard to even imagine. But like you said, Hubert, right, there are, some examples, right? They all have their own unique characteristics of human beings picking themselves up, and moving forward, almost impossible as it is to imagine. And so I think it is important, and it's important for the, the Palestinian struggle too, to think about, what does it look like, right? How do we, pursue our lives and our health, after a moment like this, and one which, sadly and tragically, and in part because of our own government here in the United States, is still ongoing right now.
And I think, a better model might be what happened to Iraq and Afghanistan after the U.S. completely destroyed those two countries post 9/11. I mean, that's a historical example of what not to do when you've experienced horrific trauma. And yet the Israeli government is basically following the U.S. template. And it didn't turn out well, obviously.
Right. Exactly. Well, we've talked about ongoing trauma. We've talked about, to a certain extent, but maybe we should talk a bit more about rebuilding the infrastructure of healthcare. And that means the training of personnel, starting up the education system again, so that people actually get through high school, get through university, get their qualifications, but also starting an infrastructure of delivering supplies again. So I guess all this is to do with, if ever this nightmare stops, how do we go about picking ourselves up?
I think that what we know is that there has to be a political solution. This is not going to be solved through a military assault. And the first thing that I really, really worry about is what is the intent of the Israeli military. I've seen reports of Israeli politicians talking about, driving all the Gazans out and setting up tent cities in the Sinai. I've seen reports of the Israeli military, Israeli politicians saying, well, the people will not be allowed to come back to the north. So I don't even know what this is going to look like at the end of this horror. If the Gazans are allowed, A, to stay in the Gaza Strip, and B, allowed to inhabit the entire Gaza Strip, there's going to have to be a massive, massive humanitarian program. And the problem with that is it doesn't solve the overlying issue, which is the blockade and the occupation. And unless the blockade ends and the occupation ends, this is not going to get better. We'll put a Band-Aid on it. I can guarantee you that the Israeli government is not going to fix what it broke, and it's going to think that the entire international community is going to sweep in and fix whatever they've destroyed. And so it's really hard for me to imagine how this is all going to turn out, partly because I don't know what the politics is going to be.
Yeah, I think that, I was going to say, I think that's absolutely right. I think what's absolutely clear at this moment is, is that things can't go back to the way they were, right? You can't go back to a situation where Palestinians don't have, basic human rights. You can't go back to a situation where people are living under military occupation, under conditions that are fundamentally a barrier to self-determination, to all the most basic aspects that people require. And I think that, piece of it, making clear that that's something we can't go back to, right? That's one of the most important parts, is saying that, we need to find a political solution that takes seriously the fact that Palestinians have been living for decades without rights, without self-determination, without sovereignty, without agency.
And I think, we keep hearing that the Israelis are going to destroy Hamas. Well, I think that we have to be clear that the Israeli military cannot destroy Hamas. Hamas is a movement for liberation. It's a movement that has a huge social service component, and it has a military wing. So even if they are able to kill however many fighters and leaders that they want to kill, the movement is going to persist, because the oppression persists. And the only way to get rid of Hamas, should they want to do that, is to address the root causes that created a movement for resistance. And I think people need to understand the fact that most Palestinians do not engage in violent resistance, despite the enormous amount of violence that they experience coming from the Israeli military and the Israeli government, and that if we want people to not have movements of resistance, then we have to address the oppression that they face.
Well, what always strikes me, and visiting the West Bank certainly, is that the vast preponderance, 99% of the population, practice nonviolence every day.
Right. I mean, I was in the West Bank and in Gaza in July and August of this year. And I actually spent a lot of time in Area C, which is where the settlers are most aggressively attacking Palestinians, burning down their homes, shooting people, digging up their olive trees. I mean, I went and bore witness to this happening. And, what the Israeli government right now is doing is arming the settlers with military-grade weaponry. And, this is a political problem. And as long as that's what they're doing, this is not going to get better.
Well, okay, I'm a natural optimist. This is what architectural training is a training in optimism. It was about rebuilding. My concern, so let's say the political conditions, in our wildest imagination, the political conditions for self-determination are established. Just looking at the medical field, my concern is lots of external, benign, charitable organizations will come in, and in a way, it is a form of benign recolonization that could well happen. Okay. So how does one build up, Bram used the word agency. How does one build up, rebuild agency within the context of what I have to admit is a very optimistic scenario?
Well, I think the thing that the NGOs cannot replace a functioning government. So if you had a functioning Ministry of Health that was funded appropriately, that didn't get bombed every year or two, if you had enough money to hire all of the tremendously educated Gazans that live in Gaza, if you had functioning water and hygiene and sewer treatment so the environment was healthier. Just looking at the environment, it's totally contaminated by military bombardment. And also, Gaza is a coastal plain, so it's also suffering from the effects of global warming. If all of those things could be addressed and Palestinians in Gaza had agency, they would be very capable of building a functional healthcare system. It's that they're functioning with a boot on their neck, and that has to get off their necks before they can do what they very well know how to do. And with UNRWA, again, UNRWA is responsible for refugee health, but it's completely underfunded. And so until the refugee question is resolved, which is the ultimate goal of this, they need to be funded adequately so that people aren't living right on the edge all of the time. And then ultimately, the refugee question has to be resolved. And that means that the generations of people who've been living in refugee camps have to be recognized as fully human people with aspirations, with history, with culture, with international rights, and they have to be given the option of reparations or return. And that is a huge issue for Israelis. And I think, so we're talking politics once again, because without a political solution, there's not going to be a humanitarian or medical solution.
Yeah, and you've both seen this firsthand, right? That Palestinians are a very, very highly educated population. All the human resources that they need are there, right? And in terms of building a health system, as Alice said, right, you need a public health system that's adequately funded, that is not attacked, that has the resources it needs, and then to do whatever we can to support that level of agency and sovereignty around Palestinian health. From the local level all the way up to the public level at a Ministry of Health level. And I think that is so important to avoid exactly the pitfalls that you mentioned, Hubert, this sort of recolonization that often happens through humanitarian initiatives that remove agency, that remove sovereignty from the population in question, which is, of course, the population, the Palestinian population, that is best positioned to service their own healthcare needs.
But given the level of the mortality in Gaza at the moment, they're wiping out generations of people. When we talk about children, these are the future healthcare workers. These are the future doctors and nurses. These are the future of that revived nation. And so, to reestablish an educational system, to reestablish a medical system, is absolutely essential, but it is a daunting task. I mean, it's really a major and long-term project.
And we have to remember that children, as well as adults, but particularly children, will not recover from this until they have safety. And there has to be safety for people. And right now, there is no safe place in Gaza. And even before the assaults, things were pretty dicey. And so unless the international community is able to accomplish a ceasefire and create a long-term safety in this society, the children are not going to recover from this. So again, the issues are daunting, but they're doable. But there has to be the will. Yeah. And I think one of the reasons that there is not the will is that there is a feeling that Palestinians are not fully human, that they are less deserving than Jewish Israelis. And that is essentially a form of racism, Islamophobia, that this world has to address.
But I think you've sort of put your finger on it there, in the sense that the role of the international community is to create the stable and safe conditions under which Palestinians can then reform their society without bombardment, without oppression, without occupation, etc. So I think in terms of roles, that's really important. I mean, one of the last things is, people always ask here, oh my God, this is awful, but what can we do? And, it's especially poignant because we are so far away, and yet we see it on our screens. And the issue is, what can we do? And how can how can people send money? How can people get engaged? What is your advice on this?
I mean, my first comment would be to say that we're not far away at all for those of us who are in the United States, right? The United States has fully greenlit the attacks on the Palestinian people that are happening right now. And so, that is only made possible because of the U.S. government's position. And so what each of us can do who are here is to put pressure, right, on our representatives to call for a ceasefire, right? That, I think, is the most urgent task. And it's the most urgent ask from Palestinians whenever I ask them. So I think it is to recognize that we're actually very complicit, for those of us who are here in the United States, and in many European countries as well, countries that have the power to put pressure on Israel to stop the bombings that are happening right now in Gaza, to stop the forced displacement that's happening in Gaza. And so I think that's, to me, the best starting point.
And I think we also need to be aware that this catastrophe is not just Israel and Gaza, that this level of attacks on Palestinians is making Lebanon angry, Syria angry, Jordan angry, Egypt angry, Iran, Iraq. This has the risk of becoming a massive conflagration. We know the Houthi rebels just hijacked a boat that they say is owned by an Israeli businessman. We're going to see more of this. And so this is so dangerous for the entire world. And so I think that we should not be in our little bubble and think that, oh, it's happening out there and we don't, those poor Gazans, we don't really have to worry about them. This is an international catastrophe that we need to pay attention to. And
okay, I want to bring you back to the medical bubble for a second.
Okay.
So in terms of helping out, I mean, you two are physicians and you have a vast medical complex in America, which needs persuading that this is their problem too.
Right. Well, the American Public Health Association just had its meetings, and after a fairly contentious meeting, because everybody has opinions on this, they were actually able to announce a policy statement that they were calling for a ceasefire. I am pretty horrified that the professional groups for psychiatry, for pediatrics, for internal medicine, for social work, we have all these professional groups are unable to get their act together and call for a ceasefire. Doctors are trained with the Hippocratic Oath. We are supposed to do no harm. We have all sorts of reasons why, no matter politically where you are, you have to oppose this level of death and destruction and killing of children. It appalls me that our professional organizations are unable to get that together. And, I think about the OBGYN, ACOG, which I used to belong to when I was actively practicing, just in terms of maternal health, they should be up in arms, and they're not. So, this is something on us. Healthcare providers tend to be fairly apolitical, and, it's a part of our own responsibility to educate our professional organizations, and for them then to put pressure on the US government.
Well, Bram, it was quite well covered in the local press when you wrote that article on racism in healthcare provision. You got a lot of flack for that, and I'm wondering, have you been active on this issue, on the Palestine issue, and what sort of flack do you get for that, either internally or more publicly?
Absolutely. I think I agree completely with Alice that as health professionals, we have ethical obligations to call out, war crimes, racism, all of these large structural factors that impact patients' health. And, sadly, I think, because of the very need, right, to call these things out, right, that means there are power structures that seek to silence those who do so, right? And so, as you mentioned, I've experienced that when looking to challenge racism as it manifests in hospitals, right, that, white supremacists and neo-Nazis have put a lot of pressure and backlash, against that kind of work. I think when it comes to speaking about Palestine, there have been pro-Israel voices in medicine who have censored and removed articles that I've written with colleagues calling out structural violence for Palestinians in Gaza, for example. And so you see this kind of censoring, silencing when it comes to speaking about these larger issues of power that end up negatively influencing health. And so, I think our obligation is, despite, these pressure points, to really make sure we're speaking out in ways that Alice mentioned, as professionals, right, as groups, because we do have these platforms and this privilege to speak in this way as health professionals.
And we also see this in academia where, people are losing their jobs because of a tweet or because of speaking out on Palestine or because of a Facebook post. I've worked with young Palestinian Americans who've lost their residencies because when they were 15, they posted something angry about Israel while Israel was bombing their uncles and aunts. So there is an industry that is largely funded through Israel, but also has a huge groups in the United States that monitor all speech on Palestine and on Israel and really go after people who raise these issues. And we've all experienced the impact of those people. But we have to be brave. We have to speak up because that is the moral and ethical thing to do. I also think that if our colleagues understood the realities on the ground, the human stories, if they could see Palestinians as fellow colleagues, that there is a chance that we could break through all of the cultural racism and institutional racism and the bias and maybe change the conversation. But it is really an uphill battle. I think that the younger generations see it more easily than the older generations. I've been finding that I keep getting invitations to speak at all these different medical schools all over the country. And I'm like, oh, this is a new phenomenon. And I'm very pleased to see it because when I was a medical student or when I was a resident, it was a very lonely time.
Yeah, this all comes back to how one can relate to these events in a distant land. I know we are fully responsible as Americans, voting in our representatives and giving all this military aid to Israel. But for your average person on the street, just relating to this, I was thinking that, the Al-Shifa Hospital with 700 beds is roughly equivalent to Brigham and Women's. I think that's a similar number of beds. The difference between Al-Shifa and Brigham and Women's, for starters, is that you've probably got two people to a bed, and you've got people lying on the floor, and you've got people lying in the corridors, which at Brigham and Women's we don't have. And then you relate to the individuals, and you've described this very well, you know, a sort of pregnant mother about to give birth, etc. How does she get to the hospital, or how does she get to care, if there is any care at all? So I think these types of stories, these types of comparisons are actually essential in getting people outside of our own bubble, who we're all concerned about this, but people who aren't typically concerned, but who can relate and maybe then act.
You know, I work with a group called We Are Not Numbers, which was started after the 2014 Israeli assault. And I am the mentor liaison. And what we do is we match, it's a Gaza-run program, and we match young Gazan writers with English-speaking writers who are mentoring them. And we help them write more compelling essays in good English. These all get published on the website. They also get published on other media. And, you know, I have found that during this assault, the voices of these writers has really risen up in terms of public interest. I mean, just this morning on NPR, the young man who co-founded We Are Not Numbers, Ahmad Al-Nouk, was talking about his personal experiences. And, you know, it started after the Israelis killed his brother. And now during this assault, the Israelis have killed his entire family. And, you know, I think that hearing his calm, measured voice with all of its poignancy and tragedy and decency is a very positive way to break through the idea that all Palestinians are terrorists. I mean, if you listen to the language of the Israeli government, you know, there's no innocent Palestinian, they're human animals, all this horrific racist stuff. But you hear a voice like Ahmed, and it's very clear that this is a decent person who's been totally oppressed by the siege and occupation and wars, and has lost his entire family, which is a hard thing for us to wrap our brains around. So I think uplifting these kinds of voices is critical, and it counteracts the sort of Israeli propaganda machine.
Right.
Yeah, I absolutely agree. I think, you know, there are many different forms of proximity, and sure, going there, meeting with Palestinians, being on the ground, seeing it, that's the most powerful. I've seen it work wonders for people who are going for the first time, but it's available to a limited number. But there are other ways, right? And we're seeing stories now, even in the mainstream media, but certainly through social media. And this is where, you know, I think especially these younger generations who are, you know, following journalists in Gaza, you know, on Instagram, on TikTok, they're being able to just see, you know, with their own eyes what people are experiencing in that way, to hear through their own voices, through their own narration, what the experiences are. That's very powerful, right? That creates that proximity in a way that drives empathy, that breaks down all of these myths and misconceptions and biases and propaganda that Alice was just mentioning. And I think that is really changing the narrative in many cases. And you know, if you see, you know, even from organizations like the ADL and others, right, this is where a lot of their concern is coming from, right, in this gap, because people are able to see the reality for themselves through these other channels that previously were not available, and that can't be hidden, even if there are many attempts to do so.
And we also see that groups in America, like African Americans, who've experienced racism, who've experienced police brutality, who've had an inordinate number of young people killed by police, that group has joined forces with the idea of supporting Palestinians. And so, you know, this isn't so far away, because the cultural forces are very, very similar. I mean, the individual things are different, but the cultural forces are very similar. So we have a much greater sympathy, I think, building in the United States, but it has to get up to the level of power, and to the Congress, and to the people who write the budget and give the money. I think we also need to acknowledge that there is a massive military-industrial surveillance complex that is making a lot of money off of this war. Yes. And that is very happy that people are buying their stuff and their drones and their military equipment. And, Gaza has long been the place where weapons are, quote, field tested by Israel. And so Israel's main claim to fame right now is it has the most egregious military weaponry in the world, and it's selling it to everybody else who wants that kind of stuff. So that sort of economic force and political force is another part of the equation that is not talked about very often, but is a huge mover and shaker in this issue.
Well, that brings to mind, what is happening in other parts of the world, never mind the United States. So in Europe, it is notable that Ireland is the real standout, the Irish actually understand what it is to be colonized and oppressed by an occupying force. And so they have a natural affinity for understanding what the situation is in Palestine.
Right.
But you mentioned the Israeli armaments industry, and I read recently that India is actually manufacturing a lot of the Israeli armaments, and they are a major client as well for buying the stuff.
Right.
So, there's a large diaspora of people either born in India or whose parents were born in India who are registered voters both in Europe and in America who actually could make a difference by registering their concerns.
And when we think about the sort of revengeful rage and fury of the Israeli government, I think we have to remember that they thought that all their drones and all their surveillance and all their intense military stuff would keep them safe. And the Israeli government had the delusion that, they had suppressed Gaza enough, they're not going to cause them any trouble, and now they can focus on taking over and annexing the West Bank. So the fact that the Israeli massive surveillance, it's unbelievable. Every Palestinian phone is monitored by some kind of Israeli surveillance. The fact that they missed the attack by Hamas was hugely humiliating to them and really shook Israelis to the core because for the first time in a long time, they felt unsafe. And so I think, the limits of trying to solve a problem by suppressing people and surveilling them and arresting them was clearly shown in this. And also the arrogance of a colonizing power that they could permanently suppress people that they have occupied and that the occupied people will not rise up against them is folly. It's just folly. And so I think there's going to be a lot of very heavy conversations coming out of this. And the question is, can the Israeli population move beyond the place where they're at? And that remains to be seen.
Do you have, I think we can sort of wrap up at this point.
Brilliant finish. Yeah.
Very much for your thoughts. We've talked about, what people can do in the United States right now in this acute phase of what is a chronic condition. And I think we sort of covered most of the points. But anyway, we thank the listeners for listening in on this. And the real challenge for us is to increase that range of listeners so that it's not just people who know about Israel, Palestine, but it's actually regular folks who don't normally think, who can be engaged, and being decent human beings will have the right reaction and make a difference.
And I think everyone can commit to say, okay, I'm going to talk to every member of my family. I'm going to talk to my medical colleagues. I'm going to bring it up, over lunch in the hospital cafeteria. Just keep pushing the ideas of what is going on there and why people should be upset and why they should pay attention. And I think that there's enough information coming out that would surprise and offend and outrage decent people, that it is possible to change the conversation. But it's not an intellectual conversation. We have to appeal to people's sense of decency and morality and their understanding of mothers were writing children's names on the extremities of their children. So when they were killed, they could be identified and the family could be buried together. I mean, just that little tidbit of information should wake people up. So I think we have all of the information we need, but now we need to share it person by person by person, as well as with our congresspeople and as well as, taking over the Space Needle and whatever the next thing we're going to do is. So, yeah.
Right. Well, with that, thank you both very much for spending this hour with us and giving us your wisdom and experience in the West Bank and in Gaza. And we can only continue to work and to stop this slaughter and work for a just and equitable solution for the entire population of the region. With that, thank you very much.
Well, thank you.
Thanks for having me.